CNA Therapeutic Communication. Welcome to the quiz. Question 1. You're reviewing vital signs for your assigned patients and interpreting what the findings mean. You obtain vital signs from Mr. Marcus Thompson, a 68-year-old male patient, and get the following results. Systolic blood pressure of 120 millimeters of mercury. Diastolic blood pressure of 75 millimeters of mercury. Heart rate of 68 beats per minute. Respiratory rate of 28 breaths per minute while at rest, and temperature of 98.6 degrees Fahrenheit. When reviewing these vital signs and determining if any findings warrant immediate attention, which vital sign would indicate a patient needs immediate attention? Option A. The systolic blood pressure of 120 millimeters of mercury is elevated and indicates the patient is developing hypertension that needs immediate treatment. Option B. The respiratory rate of 28 breaths per minute while the patient is at rest is elevated and could indicate respiratory distress, infection, or other problems that require immediate evaluation. Option C. The heart rate of 68 beats per minute is too slow and needs immediate intervention. Option D. The temperature of 98.6 degrees F is normal and all vital signs are normal, so there are no concerns. The answer is B. A resting respiratory rate of 28 is tachypneic, normal 12 to 20, and requires immediate reporting. Option B is correct. BP 120/75 is normal. HR 68 is normal. Temp is normal. So the abnormal finding is RR 28. Question 2. You are providing care to Mrs. Helen Martinez, a 75-year-old female patient who has expressed several complaints about the care provided by another staff member on the unit. She tells you that she feels the other staff member was rude to her, did not listen to her concerns about pain, and seemed impatient while providing care. She is upset and wants someone to know about her experience. You want to help address her concerns appropriately. Based on best practices for handling patient complaints about care and advocacy, how should you handle a patient's complaints about care provided by another staff member? Option A. Tell the patient that her complaints are not your concern and that you do not have time to listen to her problems. Option B. Listen to her concerns, acknowledge her feelings, document her complaint, and report it to your supervisor or nurse so that it can be addressed appropriately. Option C. Defend the other staff member and tell the patient that she is being too critical and should not complain. Option D. Ask the patient to file a formal written complaint directly without discussing it with you or any other staff member. The answer is B. Patient complaints must be taken seriously. Listen, acknowledge, document, and report. Option B is correct. Option A dismisses the patient. Option C is defensive and invalidates the patient. Option D places an undue burden on the patient. Question 3. You are preparing to give Mr. Samuel Jones, a 72-year-old patient, a bed bath. You are filling the basin with water and need to determine the appropriate temperature. You know that water that is too hot can burn the patient's delicate skin, while water that is too cold will be uncomfortable and not effectively cleanse. Based on guidelines for safe water temperature during patient bathing, which temperature is most appropriate for bathing a patient? Option A. Water should be as hot as possible to ensure thorough cleansing and to help kill bacteria and microorganisms on the patient's skin. Option B. Water should be lukewarm to warm, approximately 105-110 degrees F, 40.5-43.3 degrees C, which is warm enough to be comfortable but not hot enough to cause burns. Option C. Cold water should be used regardless of comfort, as this prevents the risk of burns. Option D. Room temperature water can be used regardless of comfort level or effectiveness, since it is easier to prepare. The answer is B. Safe bathing water temperature is lukewarm to warm, around 105-110 degrees F. Option B is correct. Option A risks burns. Option C is uncomfortable and ineffective. Option D may be too cool for effective cleansing. Question 4. You are being trained on proper donning and removal of personal protective equipment and are learning the specific sequence of steps for putting on gloves correctly. You are being shown how to select and apply gloves that fit properly and provide protection while maintaining your ability to perform patient care tasks. When putting on sterile or non-sterile gloves, what is the correct method for donning gloves? Option A. Put gloves on in any way that is quick and convenient, without worrying about proper fit or whether cuffs are properly positioned. Option B. Ensure that the cuff of the glove extends beyond and covers the wrist of any gown that you are wearing to prevent contamination of your wrist and arm. Option C. Tear or puncture the gloves if they do not fit perfectly, and wear them anyway since they are already open. Option D. Touch the exterior surface of the glove package multiple times to locate the gloves before removing them. The answer is B. Gloves should be donned so that the cuff covers the gown wrist, providing a seal. Option B is correct. Option A. Improper donning can lead to contamination. Option C. Damaged gloves are ineffective. Option D. Touching the exterior of the package may contaminate gloves. Question 5. You are working on a nursing unit where patient care plans are developed and reviewed regularly. The nursing staff and care team use care plans to guide daily care activities and treatment. You are learning about how often care plans should be reviewed and updated. Based on standards for patient care planning and the importance of updating care plans to reflect changes in patient status, how often should a patient's care plan be reviewed and updated? Option A. Care plans should only be reviewed one time at the beginning of hospitalization and should never be changed, regardless of changes in patient condition. Option B. Care plans should be reviewed once per month on a scheduled basis. Option C. Care plans should be reviewed and updated daily, or as frequently as the patient's condition changes, to ensure the plan remains current and appropriate. Option D. Care plans should be reviewed only at the time of patient discharge. The answer is C. Care plans are living documents that must be updated with any change in patient condition, often daily. Option C is correct. Options A, B, and D do not allow for timely adjustments. Question 6. You are learning about the scope of practice for certified nursing assistants and which tasks are within your responsibility and which tasks should only be performed by nurses or other licensed practitioners. You are reviewing a list of various patient care activities and trying to identify which are appropriate for CNAs. Based on scope of practice standards for certified nursing assistants, which of the following tasks is within the scope of practice for a CNA? Option A. Administering intravenous medications or intramuscular injections to patients. Option B. Performing sterile wound care that requires clean and sterile technique and dressing changes. Option C. Assisting patients with activities of daily living, taking and recording vital signs, and reporting changes in patient condition to the nurse. Option D. Performing urinary catheterizations or other invasive procedures. The answer is C. CNAs perform ADLs, vital signs, and report observations. Option C is correct. Options A, B, sterile technique, and D are invasive and require licensed nurses. Great job! Don't forget to subscribe. Bye!